So today I'll be reviewing fluoxetine for depression. Fluoxetine is also known as Prozac and belongs to the class of antidepressants called the SSRIs, which are your selective serotonin reuptake inhibitors, which help to increase the level of serotonin in the brain, which is thought to cause depression when the levels are low. Fluoxetine has many uses. It's used for depression and anxiety, quite useful in teenagers who suffer from depression, especially if they're at risk of self-harm. Fluoxetine is also used in people suffering from OCD, bulimia, can be used in depression in menopause, hot flushes in menopause, as well as premature ejaculation. Fluoxetine comes in a 20mg, 40mg and 60mg dose. You would usually start treatment with a low dose of 20mg. Fluoxetine usually starts to take effect within 4 weeks of taking the medication. You might experience some side effects such as feeling very tired or fatigue, reduced sexual libido, headaches, dizziness. You might feel emotionally flat. But the most common side effect that people tend to report is feeling tired and excessive yawning. The excessive yawning is usually beyond control, and most people find that they stop taking the medication just because of excessive yawning, as well as other factors such as your reduced sexual libido. As a whole, fluoxetine does not interact with other medications as opposed to your sertraline, which can interact with ibuprofen, or your citalopram, which can interact with your heart medications. So fluoxetine is actually safe in that sense. Fluoxetine is also recommended in breastfeeding women as opposed to other antidepressants. Now, fluoxetine is used in depression and anxiety, but it works better for depression than for the anxiety symptoms that come with the depression. So if you have depression and anxiety, fluoxetine would not be my first choice. I'd rather go for sertraline or citalopram or escitalopram. As I mentioned, fluoxetine is also quite good for bulimia, so it's usually the first choice medication in those people who are suffering from bulimia, which is a form of eating disorder. The highest dose you can have of fluoxetine is 60mg, so if you start with 20, after 4 weeks, assuming that there are no more other side effects, you can increase it to 40mg, and if you're on 40mg and you still feel that the medication is not working as well as you would like it to, then you can increase to 60mg. If at 60mg you feel that fluoxetine is not working, then you'd have to consider alternative antidepressants such as your sertraline, citalopram, and even the older generation antidepressants such as venlafaxine, dosilepine, or trazodone. However, this comes with its own side effects. So in the whole, fluoxetine is a good, safe antidepressant to take. It's quite tolerable, it works, it has little side effects, it does not interact with as many medications as other antidepressants like your sertraline and your citalopram, and it has as many uses from hot flushes to premature ejaculation to premenstrual syndrome to menopause symptoms, as well as what it's really used for, which is depression. So I hope you like this video. Please feel free to check out my other videos on antidepressants.